Granulomas, we keep hearing about them, we keep learning about them in medical school, but until the end of medical school, honestly, me personally, I didn't really have an idea of what the hell's going on with them. So what exactly is a granuloma? A granuloma is a pattern of chronic inflammation, and its job is to wall off something the immune system simply can't eliminate. The most common infections are tuberculosis. So here's how they're formed. So first things first, you have an antigen presenting cell that presents an antigen to a naive CD4 T cell through MHC class 2. Now, the APC also releases interleukin 12. This is super important. Interleukin 12, which tells the T cell to become a Th1 cell. The Th1 cell then releases interferon gamma. And this is the key cytokine that activates macrophages. Now, those activated macrophages transform into epithelioid cells, histiocytes. This is the most high-yield important thing that you have to know. So in the exam, if they ask you, what is the key cell in granuloma? It's the epithelioid histiocytes, or the epithelioid cells. And how do they present under a microscope? They are macrophages with abundant cytoplasm. Okay? This is important. This will come. So make sure you know it. Now, those activated macrophages transform into epithelioid histiocytes. So we got that through. These are the hallmarks of granuloma. Some of these fuse to form what are called multinucleated giant cells. The granuloma is then maintained with tumor necrosis factor alpha, TNF-alpha, which is another cytokine you absolutely need to know for step 1. Now, let's make this clinically relevant. Now, imagine a patient with tuberculosis. They come to the hospital and you do a chest x-ray, and this is what you see. You see a lung, you see a circle, what you call a granuloma, in the upper right lobe. What is going on? So here, the macrophages, they can't completely destroy the bacteria. So instead, they build a wall around it, trapping the infection and preventing it from spreading. This is a granuloma. This is why patients must be screened for latent tuberculosis before starting anti-TNF therapy. So something like etanercept. So how do you spell it? Etanercept. This thing right here. Yeah, this is an anti-TNF therapy. If you give it and the patient has a granuloma, then you break down the granuloma, and the bacteria that was trapped inside in the middle is going to be free to roam around, and you get disseminated tuberculosis, which is not good. Now, let's talk about the two types of tuberculosis. We've got caseating and non-caseating. Caseating means that there is central necrosis. So where is this seen? This is seen in tuberculosis and fungal infections like aspergillomas. And then the other type you have is non-caseating. So you have no central necrosis. And where is this seen? This is seen in sarcoidosis and Crohn's disease. These are two high-yield examples that you need to know, but it's also seen in other diseases. This is just the high-yield ones. Don't attack me in the comment section for missing out some diseases. All right. Now, one last thing that you need to know. Hypercalcemia is seen in granulomas. And why is that? It's because the activated macrophages inside granulomas contain 1-alpha hydroxylase. And what this does is that it activates and elevates vitamin D, right? It converts vitamin D into its active form. So it results in elevated calcium absorption, and this is mostly seen in sarcoidosis. That's why, like, one of the hallmarks of sarcoidosis is hypercalcemia. So here's your rapid review. All right, the important things you have to know are the interleukins, right? So IL-12, make sure you know interleukin 12, make sure you know interferon gamma activates the macrophages, and make sure you know that the granulomas are maintained with tumor necrosis factor alpha. The key hallmark cells are epithelioid cells. Caseating results in central necrosis. Non-caseating results in no central necrosis. Caseating is seen in tuberculosis and fungal infections like histoplasma and aspergillomas. Non-caseating is seen in sarcoidosis and Crohn's. Sarcoidosis is also associated with hypercalcemia, and that is everything you have to know about granulomas.